Hey everybody, KC here. So, because, I read a lot of weird things, I was actually perusing the Food and Drug Administration's website and looking at Section 204D of the FDA Food Safety Modernization Act, FSMA. Talked about a lot about that over the years here at Morning News Beat. And let me just read a little bit of this to you this is again about Section 204. The new requirements identified in the final rule will allow for faster identification and rapid removal of potentially contaminated food from the market, resulting in fewer foodborne illnesses and/or deaths, all of which sounds like a really good thing. It goes on. At the core of this rule is a requirement that persons subject to the rule who manufacture, process, pack, or hold foods on the food traceability list maintain records containing key data elements, KDEs, associated with specific critical tracking events, CTEs, and provide information to the FDA within 24 hours or within some reasonable time to which the FDA has agreed. The final rule aligns with the current industry best practices and covers domestic as well as foreign firms producing food for U.S. consumption along the entire food supply chain in the farm to table continuum. And I'm looking at this and I'm going on and I'm reading it and I'm thinking to myself, well, this sounds great and it sounds really good for consumers, right? But I wonder how many retailers, wholesalers, manufacturers, suppliers, C-stores, bodegas, four-star restaurants, chain restaurants, anybody who handles any of the foods on the list, and there are a lot of them, how many of them are ready? And so I turned to somebody I know a little bit. He's been on Morning News Beat over the years. Has been very supportive of Morning News Beat. Randy Fields, who is the chairman and CEO of ReposiTrak, as well as to Dr. Benjamin Miller, the Executive Vice President of Regulatory and Scientific Affairs of the Acheson Group. And because these guys are very heavily involved in all this stuff, they understand it far better than I do, because I read the stuff and it makes my head hurt. So I turned to them to ask them for a little bit of explanation, a little bit of clarity, and a clarion call for companies to know what they need to do. And so we spent a little time talking about this stuff. It's an extended conversation. It's a little longer than I ordinarily let them go on, but I really think it's worth paying attention to because this is going to be of critical importance to the food industry. So I hope you enjoy my conversation with Ben Miller and Randy Fields. Ben, Randy, welcome to Morning News Beat. Thanks for doing this.
Good morning.
Thanks, Kevin. Good to be here.
So in preparation for this conversation, I just took a look and started to look at the FDA FSMA rules, started reading them in terms of what seems to be required and when. And my first reaction to it was that in terms of 204 is that I suspect that there are not a ton of companies out there in the food industry that are in compliance with what needs to be done, or not even necessarily on track to be in compliance when they need to be in compliance. So I guess my first question is my sense of that correct? That a lot of companies have a long way to go?
Well, from our experience, and remember, we've got tens of thousands of suppliers to the retail food industry as customers, dozens and dozens of wholesalers and retailers. So I think we have a pretty good sense of where the market is. And what I can say is no one is ready yet. That would in and of itself be a problem. But more importantly, the level of understanding about Rule 204 and what it really means and what you have to do to come into compliance is even more frighteningly non-existent. I think Ben can comment on that since he's involved with getting people ready to even think about 204 and traceability.
Yeah, no, that's a great point, Randy. And I think, it's helpful to go back to why we have Rule 204 to begin with. If you think back to when FSMA was passed in the early kind of 2011, 2012 timeframe, The traceability rule, or what would become the traceability rule that came out last year, was really born out of the fact that during traceback investigations, we'd have these really big multi-state outbreaks. So I think we can remember, peppers and spinach and tomatoes and then peanut butter. And so we had these big outbreaks where we couldn't necessarily figure out the source of the outbreak as quickly as the public health and regulatory agencies wanted. And what's different, or sort of what's the sea change with the traceability rule, is that it requires this traceability lot code to be created and then maintained really throughout the supply chain. And that hasn't really existed before. We've talked a lot about traceability and recall over the last 20 years, but really the only traceability requirement that there was before the traceability rule came out last November was, one step forward, one step back. And I think most people are familiar with that, but that was only who you sold product to and who you got product from. This takes it essentially to a whole new level.
So for people who do not understand or may not even be aware of what 204 is and what it requires, Ben, give us the top level. What is being demanded of the food industry, both on the retailer and the supplier side?
Yeah, and it's important to remember too, kind of who is this rule written for? It's really written for the regulatory agency to be able to conduct a rapid traceback investigation to get to the source of an outbreak, or and kind of prevent illness from happening, because we're going to be able to identify a source most quickly. So when we think about the kind of data that's typically maintained in a supply chain, it's really meant to flow forward in the supply chain. So, I create something, I sell it to you, Kevin, you sell it to Randy. And, we need to know a certain amount of detail about those transactions so that everybody gets paid and the right amount of stuff shows up, at the grocery store shelves. What's different about the traceability rule is that investigators are starting at the other end of the supply chain. They're starting at the retail grocery store or the restaurant level, because that's where people purchased food that then ultimately made them sick. And so the level of detail that the investigators need to start that investigation and work backwards in the supply chain is we need more information. You need that traceability lot code to be able to start kind of linking, I ate this product on this date, I purchased it from this store, where did that specific lot code come from in terms of distribution? Because the other thing to know too is that in outbreak investigations, 9 times out of 10, people don't have the packaging of the food that they ate that made them sick, because they've thrown it out. It takes a long time for somebody to eat something, they get sick, they go to the doctor, that doctor, tells the health department, et cetera, et cetera. That's usually weeks between when somebody eats something and the public health authorities get involved.
So how if the packaging is thrown out, how do people have the lot codes then? How does that work?
Yeah, and so that's really where this concept of the traceability lot code came up, or was sort of created as part of the rule, was you can only assign a traceability lot code at certain points in the supply chain. One, when product's initially packaged or when it's received off a fishing vessel, or 2, when product is transformed. So when we think about things like nut butters, we create a traceability lot code when peanut butter is made. And so then that lot code has to be tracked or traced forward in the supply chain, and it can't be changed. And that's really the most significant change that the rule really causes within the supply chain right now. Because if I'm a peanut butter manufacturer, I assign that lot code to a case of product, or to, I'm going to put that lot code on the case. Let's say I'm going to send it to a distributor. That distributor has to maintain that specific lot code. They have to know that they sent 10 cases to Randy as of January 20th, 26, where they haven't had to do that before. They just had to know they sent 10 cases to Randy. Now they have to track they send cases of lot code 1, 2, 3, 4 to Randy, or if they sent 5 cases of 1, 2, 3, 4 and 5 cases of ABCD, they have to track to that level of granularity. And that's a huge change in terms of data capture and management within the supply chain.
So if Randy is the retailer, does then Randy have to what degree does Randy as the retailer have to track who has been sold the products with those lot codes?
Yeah, Randy's responsibility would stop when he receives the product at his back shipping dock. He just needs to know that he got those two lot codes and those quantities. It doesn't have to track who he sold that product to. So there's no to consumer traceability. But
Gotcha.
if you're the last kind of commercial stop within the supply chain, you have a receiving critical tracking event. You need to capture and store all of those key data elements.
So,
But
Randy,
Kevin, there's really,
I was going to say,
there's
what kinds of products are covered under this?
well, it looks, let me first comment on what Ben just said, because it sounds really easy. It's catastrophically difficult. Here's why. Historically, the idea of one forward, one back, the guy behind you could maintain information. So if you got a product from, let's say for the sake of argument, if you got a product from someone that, let's say you trust, and what happened with that was that they had the lot code, you could, in the event of a problem, in theory, you could call them, they'd give you the information. That's not the way it works under Rule 204. The information moves with the product. So at each step of the way, you have to have that lot code. So let me give you an example. When a product goes into a distribution center, you have to get the lot code somehow, some way into your system. When it ships from your distribution center, you have to know which lot code shipped to what store. And if you're at the store, where fundamentally now receiving is done more on a batch basis, you're going to have to know almost case by case what was the lot code of every case you checked in. This is such a fundamental change to how the supply chain has worked. And that's our fear, is the industry has no idea that this is coming. And now there's only about 2 years to get ready, 1 year of working days. So it sounds easy, but it's exquisitely difficult to actually execute, because systems today aren't built to do that. So there's lots of work to be done to change process and procedure so that everybody is ready.
I mean, it doesn't sound easy to me, in the sense that, I mean, I've just recently spent some time in an Amazon warehouse. I've been to Walmart warehouses. The complexity of what goes on in those places is mind-blowing, and the idea that this is going to be another layer of complexity that needs to be tracked is that's one of the reasons when I was reading the rules, I'm going to myself, there's no way anybody's really ready. Most people are ready for this at this point. But let's go back. What product categories or segments are covered by this?
Well,
or is it easier to say which ones are not?
Well, that's interesting. Let me circle back to that. Theoretically, depending on how you count, there's 16 to 19 categories of products, like leafy greens. Well, within leafy greens, there's dozens of possible products. And within that, there's literally hundreds and hundreds of SKUs. Any product that contains a nut butter that didn't go through a kill step is covered. Soft cheeses, what in the hell is a soft cheese? And so on and so forth. So there's fresh eggs, there's soft cheeses, there's a variety of different vegetables. There's any product that contains a nut butter, like an ice cream with peanut butter in it would be an example. So the reality is, once you explode that out to SKUs, here's an example. Just nut butters, we believe, appear in 40,000 SKUs. So we think that before this is all done, just the way they're talking about it, there'll be 100,000 SKUs covered by the rule. Now you've got the real problem, which is, imagine you're at a store. The store gets from its wholesaler or someone 50 cases of produce. Which of those 50 cases contain a product that's covered by Rule 204? Does that 17-year-old kid who still has acne, does he know which of those cases are covered? How does he know? How will you train him? So the reality is, we're already seeing many companies suffering from the how will we do this, and defaulting to the idea that in some categories like produce, we'll just have to identify it all. So I think, not knowing whether the FDA intended this, they certainly signaled they would like to see this spread beyond the original list of 204. But we already see people saying it's going to be easier to handle everything as if it were 204 than figure out which ones require special handling. So that means now it's many tens of thousands of SKUs that are going to be subject to traceability.
Not to go off into a different rabbit hole, but I'm curious. So you're talking about nut butters, and that 40,000 items are that are available to supermarkets might have nut butters in them of some sort. In that case, is it easier to identify which ones they are simply because they needed to be identified anyway because of the allergen? I have a daughter who's deathly allergic to nuts. And as you're saying that, I'm wondering to myself, gee, I wonder how many products she may have consumed or may have thought about consuming that had nut butters in them that she didn't even realize it because it wasn't identified. Or is it easier simply because of the allergy issue? Ben?
Yeah, I mean, I think the important thing to think about, Kevin, is that there's, as Randy mentioned, there's the commodity categories, and that sort of defines that. If you go to the rule, it's like, these are the things. Nut butter is a good example. So, that's a commodity category. But if you're an FTL food, if you're a food that needs to be traced, then if that food contains an ingredient that is one of those commodities, that also becomes an FTL food. So, it becomes tricky because you have to look at the label, you have to understand the formulation of the product. Did that ingredient go through a kill step? Did it not? So, but the reality is that a lot of those things that we think about are commodities are used as ingredients in a lot of finished products that are ready to eat and don't go through kill steps. So it's a pretty big tent in terms of the number of SKUs, as Randy was mentioning, that are going to ultimately show up and be traceable foods. It's a little misleading sometimes to look at the original commodity list and say, like, man, that's actually not that much. It ends up being kind of a lot when you look at all the different types of foods out there.
You guys have both used a term that I want to make sure we identify for people. You've both used the phrase kill step. What exactly is a kill step?
Yeah, you want me to take that one, Randy? It does have a regulatory definition. So when we think about microbiological hazards, so when we're making, and these are the things that we worry about when we're doing outbreak investigations, like in fresh produce and things like that. Most fresh produce, almost all fresh produce, doesn't go through a true kill step. So kill step means that it goes through a process that it reduces the microbial count or contamination of potential foodborne pathogens by at least a 5 log reduction. So you get 5 logs. So if you go, 1 million, you're down to 0, I think, in that instance, or 1 colony forming unit per gram. So it's a measure of microbial reduction as part of a process. And if you go back to the other FSMA rules that are out there, preventive controls for human foods, we think about designing food safety plans around the known hazards and applying validated kill steps. So it's where traceability starts to kind of marry up with some of the other FSMA rules that are out there.
So from what you're saying, is the initial responsibility for complying with Rule 204, is that rest with manufacturers, suppliers? Are there things that retailers need to be doing proactively to? I mean, who's pushing who? Who's pushing? Who's pulling? How does this play out in terms of compliance?
Randy, you want to take that one?
Randy, why don't you take that?
Well, the consumer is pulling for safety.
Right.
The industry, the food industry that you and I know, is pushing against more regulation that increases cost or difficulty of execution. And then manufacturers and growers are somewhere in the middle of all of that. The reality is that at the end of the day, the consumer and honestly, the FDA is going to win. Traceability is going to be here. It's going to become pervasive. And pretty soon, who knows, 5 years from now, we'll look back and go, yeah, it was easier just to do everything than to try and figure out what to do and not do. We don't find it impossible at all. It just requires some procedural changes and a different way of thinking. And then I think in the long run, the question is going to be, did we save any lives by doing this? Remember that enforcement, and this is an error that we're seeing in the industry, there's even some industry trade associations that we think are misleading their members by saying, oh, well, maybe it won't have to go to the store. We don't believe that, and none of the real experts like Ben that we've talked to believe it, because the problems start at the store and go backwards. They don't start at the distribution center. If somebody gets sick, it's the local health department that will be involved immediately. And they will show up, and they don't go to your distribution center. They show up at your store and say, dude, the guy said he bought the tomatoes here. Let's look at your records. And you have 24 hours to produce the records. So this is a store level, very problematic kind of activity that'll have to be done. We don't think there's any way around it.
But those record the record keeping process begins at the supplier, producer,
Correct.
manufacturer level.
Exactly.
But it's up to the retailer. Does that mean it's up to the retailer to then demand that in the relevant categories and segments and SKUs that those records are available? So if the health department comes in and says, we need to know about this arugula because somebody ate it and got sick, that retailer has 24 hours to come up with those records.
No, you
No.
used the wrong word. You used
Okay.
the word available. Availability is the old style. It means you as a retailer must have access to the records. They are your records. A distributor has to have his records, and it will contain very much the same information as the producer of the product. The difference with Rule 204 is the information has to move with the product. You cannot rely on the guy before you to have the information. You have it, he has it, everybody has it. It's a different concept.
Okay, you're gonna have to help me because I'm not sure. Okay, if the word available is when available, I meant in the sense that if they ask for it, you got to provide them, right?
Yeah, but you have to have
How
it.
is that
You
not
can't-
what this is? How
you
is that
can't-
not what this is?
It's because the way it works today, in theory, if you're a wholesaler, you could call the produce company from which you bought the product and said, hey, dude, I need some information on some product you shipped.
Okay,
That's not the way it works. The way it now works is you will have the records. You will have the lot code. You will have that available in 24 hours in a sortable spreadsheet. But beyond that, you're going to have other information, not just the lot code, about that product and its journey. So historically, people assume this. We talked to a very large produce company recently, and they said just what you said. They said, well, if there's a problem, somebody can just call us and we'll tell them what we need, what they need. Pointed out that the regulation doesn't allow for that. The regulation says you will send information to each of your customers, in essence, accompanying the product. If you get product, you must get information. It's that simple. Ben, do you agree with the way I expressed it?
Yeah, and I think that the unique change, especially at the retail end of the supply chain, is that there is that expectation to maintain very specific what the rule calls key data elements, right? So there's a receiving critical tracking event. So, Kevin, if you own a grocery store, you're responsible under the regulation for maintaining that receiving critical tracking event and all the related key data elements. And it is, as Randy says, because I used to do this investigatory work when I was, a regulator, would call up the grocery store, call up the restaurant, and oftentimes they'd say, well, we'll have to check with the distributor to see what they sent us during that time frame. This changes that model because they have to be able to say, well, I know definitively what I received on, November 27th, 2023, because I had to capture it in my system. So I know I got 5 cases of lot code 1, 2, 3, 4 of that arugula. Like that is essentially the big change that happens with this rule.
yeah. I mean, as a practical matter, I would think for retailers. I mean, you made the reference to Randy, the idea that some trade associations are pushing back, saying, "Well, this shouldn't. This doesn't really affect the retailer." I would think it's in the retailer's selfish best interests to have this information, because if somebody gets sick from something they sold, at the end of the day, the retailer is not holding the supply. The retailer is going to hold the consumer is going to hold the retailer responsible. And so to be able to respond quickly and efficiently and within the requirements of of 204 or any other regulation is just in their best interest. To say, well, it's not really our problem, strikes me as being kind of counterproductive, if nothing else, not in their own fiduciary best interests.
Well, Bill Marler would refer you to the concept of strict liability. And the
Yeah.
concept means that the guy who sells it has essentially the same liability as the guy who made it. You're absolutely right.
So what is the deadline on all this? When is compliance required? And I suspect because of the way the government works, compliance is going to be required at a certain point, but then enforcement's going to come sometime later. So how does that all play out, Ben?
Yeah, the compliance date is January 20th, 2026. So, a little more than 2 years and 2 months away. But, I think as Randy has pointed out, you kind of boil that down to working days and you're right around a year. The government definitely will educate before it regulates in this space. But I think one of the important things to know is that compliance, unlike some of the other FSMA rules, which were kind of staged. So, for large companies, they went first. Smaller companies had a few more years to comply. It's everybody all at once with traceability. And the reason for that is because, to have effective traceability, you need the entire supply chain to be compliant, to really kind of gain the benefits that you would expect out of this. But you're right, Kevin, there's going to be a compliance sort of grace period while they go out and do education around yes, this is what you need to have in place and things like that. But, I think the reality, and I would go back to, what we've been talking about just a minute or two ago, is that, well, the regulators may sort of have this educational period, their expectation is still one of compliance, right? Because there will be outbreaks. We've just seen an outbreak going on right now associated with melons, where we've got 100 cases of illness and 45 hospitalizations. And melons are going to be an FTL traceable food. And so, should that outbreak happen on January 21st, 2026, everybody that handles melons is going to be in a better position if they've got their traceability systems in place, especially from a potential liability standpoint. So, I think those are sort of the two realities that I think industry needs to think about and contend with. You've got the regulatory time frame and then the liability time frame that might occur if you're associated with an outbreak.
And
interestingly, if I could add to that,
Sure.
Kevin. In fact, we've got a webinar tomorrow with Sean Stevens, whose law practice is built on defending retailers and suppliers against foods. He's the antichrist, if you will, to Bill Marler. In his view, the FDA is at most going to push back the enforcement deadline, because technically it is the rule now. It is the state of the world today. What they've said is enforcement won't begin until January of 2026. But from a legal perspective and litigation perspective, people are going to be on the hook, certainly effective by that date and potentially sooner. So there's a regulatory risk, which is one thing, but it's never the regulators that are the biggest problem. It's the lawyers. And I mean that in the kindest possible way. Nice people. They just want to put their hands on your wallet if you've done something that could have been prevented. So this is going to be messy, it's difficult, and it's far more. Remember, at this point in time, it's fair to say, I don't mean this as a tout, we're the only company that's actually doing traceability for real. We have, a couple of thousand suppliers in our pipeline. It's probably 30 or 40,000 SKUs that are in that pipeline for traceability. We're doing it from the store all the way back to the supplier. It's non-trivial. It requires a change of mindset. And time is not the friend here. Time is completely the enemy.
A couple of quick questions. One, this affects anybody who sells the items that are covered. This is not just supermarkets. If you're a convenience store, you're a bodega in New York, you're a 4-star restaurant. This covers anybody who's selling that's covered. Am I right on that?
Mm-hmm.
Yep. Yeah, that's right. There's, there's a $250,000 exemption, but that applies to all food sold. So, it doesn't take long before you're over that amount, for most locations. So for all intents and purposes, it applies to, the vast majority of retail and restaurant, locations in the supply.
And I don't want to get into politics here, but I know there are people out there watching this saying to themselves, well, listen, who knows who's going to be in charge of the government in 2026? I don't have to worry about it because if there's a change in administration, Congress changes hands, I'm not going to have to worry about this. They're gonna get rid of it all. Is that in any way, shape, or form a legitimate approach to this? Anybody?
And I can say, having been on the regulatory side of the world, at the state level, and certainly working with FDA and CDC at the federal level, what I'll say is that I have not seen food safety really be, a partisan issue, right? People expect that the food that they buy in the store is safe, and I think if we look at if you kind of map outbreaks and food safety legislation across kind of the timeline of who's been in the White House, it's not a good predictor. The party in power is not a good predictor of when you end up with stronger food safety regulations, because I think, as Randy said, the consumer expects it. We expect safe food, and this is a tool that sort of improves, that obviously would help improve food safety. Again, if we're looking at a cantaloupe outbreak that's killed 2 people in the U.S., actually in Minnesota, where I am, you don't expect to eat cut cantaloupe and not survive, and so this traceability rule,
and that
really
seems like a reasonable expectation to me. Right? That doesn't
right.
seem like
Yeah.
a concern.
Yeah.
So let me ask you both a question. Can you name us just for as a benchmarking exercise? Can you name a supplier and a retailer who's doing it right in terms of being on track to be where they need to be when they need to be there? Is there somebody you would hold up and say, yeah, they get it?
Well, from experientially, there's certainly some, I'm not sure getting it is the right way to put it, but care enough to make changes. There is a change the way Rule 204 came out. People were originally expecting a certain set of what are called key data elements, KDEs, and they changed. So in other words, everybody who thought they were prepared, produce people who've been following the PTI for years, the PTI doesn't cover all of the KDEs that the FDA is now asking for. So we certainly have a number of companies that care enough that they're proceeding to make the changes to provide the data that the FDA wants. But if you said, can anybody today produce the information and send it along the way the FDA asked for? We don't have any. We're helping them to do that. It's our job. But independently, no, we don't see it. And certainly not retailers, and absolutely not wholesalers.
So there's no but is there a wholesaler retailer? I want to just nail this down if I can. Is there somebody out there that you would say, okay, but they're putting these are companies that are putting in place the things they need to put in place on a timetable that will enable them to meet the demands of Rule 204 when compliance is required?
Yeah, not touting again, but our customers are certainly doing that, and it's a number of wholesalers and retailers. So we have people marching down the road. I think, but there's a series of just technical issues. Here's an example. We don't know of a warehouse management system that can contain both the lot code and the origin of that lot code. There's not enough free fields to allow for it. So people are thinking about having to change warehouse management systems, retail receiving systems. The perturbation of this is incredible across the industry. That's why it's problematic.
So Ben, is this something that that requires? I'm curious if this requires CEO. For companies to get this right, do CEOs sort of have to take control and force it, or are the people who are doing food safety or handling operations at the warehouse level, whatever happens to be, are they empowered by their organizations to sort of make this all happen? Or does this require, in your experience, a CEO sitting down and saying, "Oh no, okay, we need to make this happen," and mandating that the people in the organization do the things that need to be done?
Yeah, I think this rule in particular is more than just food safety, right? I mean, obviously the other portions of FSMA touched on a variety of different aspects of operations, but this almost more than anything else is kind of an all hands exercise if it's going to be successful, because it falls to food safety people to understand what the requirements are, but then it requires your supply chain, your logistics, your IT, your legal, your finance. The first recommendation that I can give any company is think about who you want on your multidisciplinary team and then pull that team together tomorrow. And I think in a lot of companies that does require the mandate of leadership, be that the CEO, COO, whomever, who has that authority to say, this is a priority and we need to put together a team and we need to get started.
So there's another challenge, right? Because if it requires the knocking down of silos, I mean, historically in the food industry, that's one of the hardest things for companies to do. I mean, it's just, I've been writing about this industry for 40 years. I'll bet you the first month I was writing about it, I was writing about silos, and I'm still talking about them today. That's a really difficult thing for companies to do.
100%.
Yeah,
it is. But I think it's similar to when we talk about food safety culture too. That's been kind of the hot topic buzzword, but that really requires the same thing. It's, you need leadership commitment to sort of break down those silos, and this is a perfect project that you could say your food safety culture ship out of port with too.
So real quick, Ben, I'll start with you. People watch this and say, holy whatever, we need to do something. Who do I talk to? What do I need to do? What would you say there should be their first step?
Yeah, no, I think that first step is think about who you want on that multidisciplinary team, because it's going to require that level of problem solving. The second thing is understand the rule, understand the regulation. And that's really where I've been spending a lot of my time over the last year, is just helping people. You said, Kevin, you read the rule, it's whatever, over 100 pages long with all the comments and things, so I've been sleeping with it under my pillow. So if I don't remember and understand it at this point, I haven't been doing my job. But I think that's really the kind of next key, is sort of what do I need to do and what do I need to understand about all the nuance that's in there in terms of compliance. And then
I'm sorry you have it under your pillow. I feel awful about that.
it's thick enough, it's a good night. But yeah, no, but I think and from there you can identify the gaps that are in your current system. As Randy was talking about, if you don't have that field in your warehouse management system, well, then we got to get that field in there. But you also need to understand, how are you getting data today from your suppliers? And if you're a supplier, if you're not at the end of the supply chain, how am I going to send data to my customers? Because that's where the rubber meets the road, and that's really what you need to start building out, is sort of figuring out where those gaps are.
Randy, you want to add to that?
Yeah, interestingly, I think when the FDA and others began to think about this years ago, they thought about it backwards, meaning they started at the part of the supply chain where people grow food and make food. And they forgot that the real problem isn't going to be there, because you can put ultimately most of what you need to put on a label. But it presumes that the person that receives the product with the label can read the label. And you have to think about that for a minute. Imagine you're a distribution center, you're a retailer. You probably have, we're guessing, typical retailer will have, or wholesaler, 300 to 500 vendors, 300 to 500 vendors that have Rule 204 products. So do you have to scan every single case as it goes into a distribution center, and then scan every single case as it goes out of a distribution center, and then scan it again when it goes into a retail store? So the suppliers didn't think about the fact that the label alone doesn't get you there. The retailer can't read 500 different labels, can't scan every case that goes into a distribution center. All of these things were non-starters, but because they spent so much time thinking about the field, if you will, where they grow things, or the manufacturing plant where they grow things, Nobody thought about the end of the supply chain where they have hundreds of suppliers gathered together in incompatible systems and data. It's a mess. It's a mess.
Well, I think we'll leave it there. It's a mess, but you guys are able to help people fix it. It's it's fascinating, and it's amazing to me. I mean, Randy, you and I started talking about FSMA so many years ago, and it's this thing that just keeps on giving, right? And or keeps on taking in a lot of ways, and but it's something that people have to pay attention to, and I appreciate you're both adding a little clarity to it today. So thanks very much. Good luck. I'm sure we'll talk about this more down the road.
Thank you.
Thanks, Kevin.
Thanks, guys. Appreciate it.